All right, let's talk about a major shift that's happening right now. We're seeing mental health move from something that's hidden, something whispered about, to something that needs to be treated as essential infrastructure. Yeah, I'm talking as vital as our roads and our power grid.
Because it's time to get real, it's time for the truth, this is urgent, and it's a reality that we just can't afford to look away from anymore.
And this, right here, is the heart of it all. The question really isn't if mental health is going to define the next 10 years, but how it's going to define them. There's a wave coming, and honestly, it's building a lot faster than our current systems are ready to handle.
So here's what's so critical to understand. This isn't just one trend, it's several massive forces all converging at once. By 2030, the WHO says depression is going to be a top global disease burden. At that exact same time, Africa is set to have the largest youth population on the planet. And you can bet the pressures of city life and digital stress will just pour gasoline on that fire. It's a perfect storm.
But data and projections, they only tell you part of the story. This isn't some abstract problem for 10 years down the road. It's real, and it's being lived by people all across the continent, right now.
Let's start with Chipo in Zambia. Her story represents millions who are trying to find their way in a really uncertain world.
For Chipo, anxiety isn't just a feeling, it's a constant. She feels totally lost, with no clear path to get help, and no system even set up to notice she's struggling. She is completely and utterly on her own.
And this pressure, it comes from all different directions. Meet Kwame. He's a student in Ghana, and he's buried under just immense expectations, both in his studies and financially.
Kwame knows something's wrong. He knows he needs support, but the roadblocks are real. It's too expensive, it's too far away. So for him, that pressure just keeps building and building with absolutely no release valve.
Now, let's go to Kisumu in Kenya and meet Amina. Her story shines a light on another huge barrier, one that's just as powerful: culture.
Amina is battling postpartum depression, but the cultural norms around her make it almost impossible to even talk about. It's seen as some kind of personal weakness, something you're supposed to hide. So she's left to carry this incredible weight all by herself.
And finally, there's Thabo in Soweto. His story is so important because it shows how this crisis doesn't just affect one person. It ripples out and touches the entire family.
You see, Thabo is the provider. He's the rock. He feels this immense pressure to be strong for everyone, so he suffers in complete silence. He's quietly breaking down, and without even realizing it, his struggle is shaking the very foundation of the family that depends on him.
Chipo, Kwame, Amina, Thabo. You have 4 different people in 4 different countries, but their stories all point to the exact same troubling pattern. Stigma forces them into silence. The systems we have just fail them, and simple, affordable access to care is just not there.
So, what happens when you take these 4 stories and you multiply them by millions? Well, the problem scales up, big time. It stops being a collection of private struggles and becomes a full-blown, visible crisis that hits our economy, our communities, everything.
This is where we pivot, because to solve a problem on this scale, you can't just throw another app or another clinic at it. AfriPharm Health gets this. Their whole approach is different. It's about building the underlying infrastructure that connects all the dots. And this model is really something. It's built on 5 pillars that are all interconnected. You've got virtual care to eliminate distance, a home care network to bring support right into the community, pharmacy partners so you have local access points, even an AI named Dr. Cheerful to help with early detection. And it's all tied together with a secure health vault for the whole family. It's a complete ecosystem. Now here's the magic. Look at how this new ecosystem completely rewrites those stories. In the old system, Chipo is lost and just guessing. With this new infrastructure, she's guided. Kwame isn't stuck waiting forever. He gets connected right away. Amina doesn't have to hide anymore because care literally comes to her home. And Thabo isn't breaking alone. His entire family gets the support it needs to stabilize.
That is what real infrastructure does. It takes all those individual, disconnected stories and channels them into a reliable system. And a system that actually works, that's what gets you real, positive outcomes.
So this isn't just an idea. It's an open invitation. It's a call to build this, together. For healthcare professionals, it's a chance to reach people you could never reach before. For pharmacies, it's a chance to become a vital front line for your community. For doctors and nurses, it's a whole new way to deliver care right to the heart of where it's needed most.
And that call to build, it's starting right now. In fact, for the first 50 pharmacies that join this network, AfriPharm is giving them priority onboarding, making them the very first access points in this new system.
So let's end with the most important truth of all. This issue isn't going to wait around politely for new hospitals to be built. It's not coming. It's already here. It's in our homes with families like Thabos. It's in our schools with students like Kwame. It's woven into the very fabric of our communities.
And that leaves us with this final thought. The debate about whether a crisis exists, that's over. The stories, the data, it's settled. The only question that really matters now is this: will the system respond?